I'm Louis Ovey. I was in the Korean War as a young Marine. My inspiration to become a plastic surgeon occurred there. And from the early on, the concept was more to regenerate, not operate, not medicate. So I've been using stem cells in plastic surgery unknowingly for about 30 years. And this is my journey and kind of a global view of what I do in my clinic. I have a great staff, most of them are here. And we do have the future of medicine is really in regenerative medicine. It's use of stem cells, adult stem cells. And we've been in this clinic for a long time. We've gradually expanded to a 13,000 square foot facility. We had the first licensed center in the state of Florida for plastics. We've had a license over 30 years, and I do work with a pretty large staff. I work with Dr. Lee in South Korea. We're actually in partnership with the OB Medicon lab. All of our specialists are board certified. They're leaders in their specialties in the community, but we have a research lab. These are what stem cells look like in culture medium. This is one of our cultures. This is actually a whole cluster of thousands of stem cells. Stem cells kind of line up. They walk in a straight line. They march straight forward. They're cells that are undifferentiated, so they can multiply. They also cells have potency. They can regenerate almost any tissue in the body. So these are kind of individual cells. They're mononucleated cells. And this is what they look like when you first plant them in culture. And stem cells, I mentioned, we're born with about 300 sex trillion stem cells, mostly the accessible stem cells in the superficial fat layer. Very few cells in the bone marrow. And there are different types, and I'll go with the types. And this is bone marrow. Only 1 in a million cells in bone marrow are stem cells. They're a very low amount. If you take 2 ounces of bone marrow versus 2 ounces of fat, you end up with about 10,000 cells, maybe 5,000 or less live cells. 2 ounces of fat contains up to 100 million live cells. So it's a much better source. It's 36 steps from fat to stem cells. So we take the fat, we centrifuge it, and this is all equipment and disposals manufactured by Medicon in South Korea, Dr. Lee. Dr. Hee-Young Lee is a plastic surgeon, PhD. He's been doing stem cells over 20 years. He's one of the leaders in the world. So we use his system. And so this disposal syringe, everything's enclosed, everything's sterile. We centrifuge and condense and squeeze the cells in a small quantity. And at the bottom is a little pellet that we retain because that has a lot of stem cells. So once we squeeze the cells and prepare it, then we go through the 35 steps. These are the 35 steps. This is one of the first times we did this 8-9 years ago. And we have to use an enzyme, collagenase. Liberase is the trade name. It's FDA approved, it's GMP, good medical practice collagenase, and we actually have to digest the fat with this enzyme. So we mix it with the fat. We toss and tumble, incubate at 37 degrees Celsius for an hour, and then we have to spin the cells down. And we have to count cells. Dr. Heekin will tell you, but this is so important. This, we put a half cc in the cassette, and we can actually count the live cells, dead cells, percent of viability. We know what we're administering to the patient. And this is the same counter that the Mayo Clinic used in their research lab. And then that's what we look at. And this has 8 times 10 to the 7, which is 80 million cells. This is the first one. It's a little more, this is sped up, but it's not that dramatic. This is, we use a syringe now. This is the first one we did. So this is what I told you. We squeeze the cells. I've been doing it for many years. I never felt a thing. So we toss and tumble, 37 degrees Celsius with collagenase. Then this is adding the liberase, which is collagenase, and we do this many times. And so this is the incubator, and then when we take it out of the incubator, we have to centrifuge the cells to the bottom. So then we have to centrifuge the cells to the bottom, then we have to rinse 3 times. So we're doing the rinses. We have to rinse the enzyme out of the stem cells, because we're going to give it not only in the joints or target locations, but also IV, intravenously. And we have 8,500 patients in our database now. And so this is being injected in hand, this is ankles, all the different joints can be injected. So this is, we draw 2 ounces of blood. And again, everything we do is enclosed, sealed units. So this is the lounge, weight room, and we have 2 overnight rooms. This is doing the C-arm for spines and imaging, so we do all that. We review the patients. Dr. Heekin has to order the MRIs, and Dr. Edie, and they review the patients, and they want to make sure there's good potential for benefit before we do this. And this is with a C-arm for spines, hips, and different places. We had a symposium last year for international symposium for doctors, and we had great faculty. This is at our workshop. We had a workshop in the clinic, and we also had lectures at Memorial Hospital. So we did all these procedures for our audience. Dr. Gadenholm is a 3D bioprinter from Sweden, Dr. Lee from South Korea, and his staff, and this is Sean M., who works with me at the lab. You have to use living inks, bioscaffolds with your stem cells. 2 ounce fat, 10 to 50 million stem cells. You have to expand them because you need 50 to 100 million stem cells per gram of bioprinted tissue. We actually did a nose, and this is a nose we printed, a baby nose, but we did it. And so I started out over 10 years ago working with Palomar out of Boston. They introduced me to Dr. Lee and Dr. Yoshimura, and helped them pioneer platform, laser platform. This is a lady who's a pilot that we did her just with a laser. It's internal laser, but no downtime. Went back to work in 2 days, and then we do the next the same way. And then we combined laser tightening of skin with stem cell facelifting. This is the book I'm published in. First book ever published on stem cells in plastic surgery. And this lady was all non-surgical, facelift and neck lift. And you can see how she evolved. And we've done hundreds of these patients. Yeah, we also use it in plastic surgery, reconstructive surgery. This lady had mastectomies, lost her implant with a MRSA infection, oversized hair. So we're able to tighten her and actually thicken her skin and muscles with scaffolds and stem cells without doing an autologous flap from the abdomen and her back. And we sculptured her abdomen and thighs. So this to work with. OB Medicon Lab is next door. We just put that in a little over a year ago. So the main benefit is we can verify what we're doing in the clinic. We know that we have live cells. We can plant them, we can grow them, we can sand them. So, verifying the number of cells, you know that you have real cells from your fat, all the 36 steps we're doing, and this is what it looked like. Again, there's a lot of research on stem cell-based research on treating diseases we could not treat before. This just came out 2 days ago. I just picked up this article 3 days ago, and it's amazing. You can take stem cells, kind of march in line. They have extracellular vesicles. They communicate with each other. So what you can do is you can take a baby or child's defective cells, take them out, replace the gene or bad cells they have, put the stem cells, expand them, put them back into the patient, and they'll communicate with the bad cells and overwhelm the bad cells and eventually correct the problem. And this is, again, mesenchymal stem cells. From fat, the mesenchyme or mesenchymal stem cells from bone marrow, hematopoietic, good for regenerating blood cells. And then you have cord cells and embryonic cells. But anyway, they talk to each other and they communicate to each other. And that's the whole concept of stem cell-based therapies. And this is a defect. It's on the X chromosome. So we take this out, take the slot out, put a normal one back in, and then expand the cells and give them back to the patient. This is the automated system. We had the first one in the world. We're doing an IRB on it. We can't use it until we have the IRB approved. So it shows you how instead of 36 steps in 2 steps, 1 hour, it does all this in an automated fashion. But we have this, but we can't use it on patients yet. So incubator's in a drawer at the bottom. It tosses and tumbles automatically, and then And then these disposals are just approved by the FDA about 2 months ago. So everything goes in there. It does 16 cycles in about 16 minutes. And so it does everything we have to do manually now. So that's the disposal. And then the stem cells at the end are sucked off the top and used. And so, again, we count the cells. And so the only thing it doesn't do is filter. We have to filter. So anyway, this is our dream center. We just need $100 million. Anyone wants to donate, come forward. This is what we're going to do. So anyway, I'll leave everything to the next generation of plastic surgeons. Thank you.